Hi, my name is Christine Briggs and I will be the student nurse for today. I'm going to be teaching my patient about how to take their own blood pressure and how to take their own pulse and basically how to just take their new medication safely. And their new medication is Metoprolol. So the patient came into the hospital having chest pain. This was a missed opportunity patient teaching for me. And so the patient came into the hospital having chest pain, and the patient was confirmed by blood work that he was having an MI, so a cabbage was done to treat the still blocked arteries. And 4 days post-op is the day I had him during care. And he developed hypertension, so he was put on a new medication to treat the hypertension, which was Metoprolol. And that's what I'm going to be doing this patient teaching on today. So when the type of environment you want to set up for this patient is, so he had glasses, so you want to make sure his glasses are on so he can be able to read and he can see you better. He doesn't have hearing aids, so that's not a barrier of communication. A patient can only read at an 8th grade level, so it needs to be more direct and simple in teaching. Make sure the TV is off and have patient's wife at the bedside while doing the teaching so she can learn as well in order to be able to help him at home. Provide privacy while doing the teaching, so like shutting the door, having the door closed so there's no distractions like outside noises. During my day of care, my patient didn't have a roommate, so if they did have a roommate and it was a noisy roommate, then kind of like provide privacy, like either could find another room possibly to teach them in, or close the curtain, or something like that. And you want to have the patient's phone turned off, because if if he gets a notification, he might want to look at his phone. So make sure that's off. The patient's preferred language is English, so you want to make sure you're teaching your patient in the language they prefer. And you want to assess his pain level, because if the patient's in pain, he may not want to he might not take in as much information as he could if he wasn't in pain. And you want to sit at eye level. So this is like a picture of what a level you could look at, like sitting, like you want to sit eye level and you're not like standing over them and stuff like that. Okay, so the types of required materials that you would want to have in order to teach this patient about the medication is, you want to make sure you have a watch with a seconds hand, because that will help with taking the pulse, because I'm going to be teaching the patient how to do his own pulse. And then you want to have a stethoscope and a blood pressure cuff. And you want to see if the patient has access or can afford a medication box like this, because it will help a lot better with keeping track of when he has taken the medication, so he knows when he took it and what next time when he needs to take it. So I'll backtrack. So the first thing that I will be teaching him is about taking your pulse. So this is something I would have given the patient that day to take home with, like a required material. So you want to make sure you help the patient find his own pulse. So you want to feel the wrist. You could do radial, you could do apical, but in this case, Metoprolol, you want to do an apical pulse. So that's a little bit easier when you have a stethoscope. So you would listen to the heart, listen for the blub-dub, and you would count the heartbeat for 30 seconds. So you'll have the watch in front of you, and then you will count 30 seconds. Well, you'll watch the clock for 30 seconds. You'll be counting your heartbeat. And once you get that number and the 30 seconds is up, so say he counted 30 beats per minute on his heart rate. So then you would multiply that by 2. So 30 multiplied by 2 is 60. So 60 would be his overall heart rate in 1 minute. And with Metoprolol, you want to make sure your pulse rate is over 60 beats per minute. And if it isn't, you would withhold the medication, because the Metoprolol lowers blood pressure. So you have to at least make sure your pulse is over 60 beats per minute. So he would withhold the medication and call his doctor. And then with the blood pressure, so I would also provide him with this printout for how to do his blood pressure. It's like a simple little thing of showing like where his blood pressure is normal and what numbers it would be to have to if it shows him if it's elevated and if it's high. So metoprolol, you don't want to give this medication when the blood pressure is low, the systolic or diastolic, or yeah, the systolic. When it's under 90, so it's the diastolic. So if the diastolic is under 90, then you want to withhold this medication because it decreases your blood pressure, and if your blood pressure is already under 90, then it could cause hypotension. So you would want to teach him that you would want to withhold this medication. So I would also teach him how to do the blood pressure. So you would want to wrap this around your arm. So the artery line, there's an artery line on the cuff. And you also want to make sure he can afford these materials, because some patients can't afford them, and if he can't afford them, then you could refer him to case management and they could help him with that, and maybe insurance could cover it too, so that he could work that out so he'd be able to get one of these. So he would wrap it, so he would line up the artery line on the arm at the right spot where you feel the brachial pulse, and then he would turn the knob tight, and then you would pump up. And when you pump up, you would watch this dial, and you want to listen as you pump up. And as you listen, you'll be hearing the heartbeat as it pumps. So when you pump higher, you want to pump where the last beat you hear while you're pumping it up. You want to pump it at least 10 to 20 millimeters of mercury higher than what the last one you heard. And then you would teach him to slowly turn this backwards. So turn it backwards to deflate the cuff. So then when he listens, the first beat you hear is the top number, and then he'll keep hearing the beat go lower as the dial goes down, and he has to keep track of where the line is at. And the last one that he hears is the bottom number. So if it stops, so say he hears a heartbeat pumping up to 120, so he would pump up the cuff to about 140, and then you turn the knob and listen. So then the first beat that he hears is at 120, so the top number would be 120, and then it keeps beating, and then so you keep watching it until you hear the last beat, and whatever the last beat is that it's on is the bottom number. So say it's 80, so it'd be 120 over 80 is the blood pressure. So that's something you would want to teach him also. You want to teach him what is considered to be high and what is considered to be a low blood pressure. So that's what this helps with, this little chart that I just showed you. And also with the medication, it is helpful to have one of these boxes, because so say he's taking metoprolol every 8 hours. So then every 8 hours is 3 times a day. So he can get a pill organizer where it'll say like one takes at one time, and then 8 hours later the next time is in the next box in the same day, and then he knows to take one. So then he knows when he has taken one, and if he missed one, and if he missed one, then he'd know that he missed one, because he saw it in the pill organizer that he missed it. So it's really helpful to have one of those kind of medication boxes. But if he doesn't have one, and he doesn't have enough money for one, you could also get like an egg carton. It's like a creative kind of way. You can take an egg carton and like separate them out in that order, or in that way, I mean. And another thing you would want to teach this patient is when to call the doctor. So like when he has any signs and symptoms of excessive fatigue or dizziness appear, If he's going to be taking any over-the-counters, he should contact his doctor before doing that, because it could affect the metoprolol that he's taking also. You want to make sure you teach him not to double dose if there is a missed dose, because double dosing would just decrease your blood pressure even more, and he could develop hypotension, which is not a good thing. And activities you want to avoid until response to the medication is established. So like maybe driving, you want to make sure he doesn't drive for a whole day, to let his body get used to taking the metoprolol so he knows what effect the pill has on his body. And you also want to teach him to keep a logbook. So like take a piece of paper and you write a little table out so he can write the date, and then he can write his pulse in and write his blood pressure in, and every single day, every time before he takes the metoprolol, he can write it down, and then he could give it to his doctor when he goes for a follow-up on the metoprolol. And you want to have this patient teach back the information that you presented. So I would have him show me how to take his own pulse and have him show me how to do his blood pressure. Like have him demonstrate it back to me so I know that he knows how to do it himself. So I don't just send him home and he didn't know and he didn't ask a question. So I want to make sure that he knows how to take his blood pressure, and I want to make sure he knows how to take his own pulse. And if the wife is also there, it would be a good idea to probably teach her how to do this as well. So then he could help him at home. Like she could possibly do his blood pressure sometimes, or she could take the pulse. So it's just a good thing to have his wife in there, just so she knows about the teaching as well. And then she could help him do the blood pressure and do the pulse. So you could have the wife even demonstrate it back to you so she understands it as well. So observation of the patient demonstrating the learned materials back. So that's what I just said. And if the patient has any problems or questions, he can call his doctor about it to ask. So at the end of the teaching session, patient and his wife should have a good understanding of how to take blood pressure and pulse before taking metoprolol, how to organize metoprolol for times it should be taken, whether it's being taken every 6 hours or every 8 hours. Just make sure he knows how to organize it in the right medication spot, like boxes if he has a medication box, or in the egg carton if he doesn't have a medication box. And when to call the doctor, and most importantly, how to safely take metoprolol. And after my teaching, I would have them teach it back to me to make sure that they understand the material that was taught. And then I would have the bed and lowest position, call, bell, and reach, personal items in reach, and then I would go document. And that's it.